This slideshow will go into infectious diseases and how they can affect your immune system. After you read the chapter, you should be able to explain how pathogens infect humans and how infectious disease can spread from one person to another, identify common pathogens that infect people and the diseases that those pathogens cause, explain why vaccines are an important defense against infectious diseases, describe how your immune system defends against infections, explain how to maintain a healthy immune system, and understand how sexually transmitted infections and other ones can impact your body. So, germs are obviously the key component here. And a lot of times we think of microorganisms as being harmful, but one of the exciting things, if you want to call it that, is that they actually can be very helpful. Certain types of bacteria thrive in your body and aid in digestion, but some forms, of course, make you sick, and those are the ones that we want to focus on. So, what is an infectious disease? It's something that occurs when the body is invaded by a pathogen that causes a disease. So, there's kind of a couple ways to look at it. One is if it's localized and it just affects one part of the body. So, maybe you get bit by a bug in the summer or a spider, and that area becomes infected. It could become systemic in some cases, and this is when the infection isn't just going to be in that localized area, but it can kind of go and spread throughout the body. It can even go into the bloodstream, the intestinal tract, and so on. The picture you see right now shows someone who has conjunctivitis, which is basically having an infection in the eye, or we call it pink eye. So that is something that we do see from time to time. So just thinking about this triangle here and the path to infection, the epidemiological triangle is basically going to put together all the components. You have the agent, the host, the environment, and then the amount of time is in the center. So of course you can't see the environment portion covered by my circle, but basically these are the things that work together as key players. And the epidemic would be a time when an infectious disease affects many people. And of course we obviously in 2019, 2020 went through a pandemic which actually infected more than just one geographic area, but of course the entire world, which hopefully we don't ever go through an experience like that again. But obviously we did see that already. So thinking of modes of transmission, you have person-to-person contact. Food can be the transmission. Water, air, a vector, or a mother to a baby, which is considered perinatal. So thinking of this chain here, as you see like a reservoir, the infectious agent resides in that reservoir, like a human body, bloodstream, water, animals. There's then that mode of transmission that uses a specific way to take it to the next host. So I think of like HIV, how it goes from the bloodstream of one person that's the carrier and can get into the bloodstream of another person through whichever mode that occurred through. You have the portal of exit when it leaves the reservoir, and then of course the entry when it enters the other person. So in HIV, if someone has sexual intercourse, the person that they might be having sexual intercourse with could get it from them if they transport it through sperm, vaginal fluid, or blood-to-blood contact. So that's just one example of how that could happen. So there are risk factors that we have to keep, in consideration or under consideration. If a child is less than 5 or an adult is over 65, they are at a higher risk of being infected. Vaccination status can be something to be concerned with. An unvaccinated person in a community has a higher likelihood of spreading infection and causing spread. The environment, so there are things like unclean water, which can increase the risk. And then the organism virulence and resistance. This is the ability of a pathogen to spread and kind of overcome what it's around that can cause disease. And you kind of think of maybe things like COVID, how it's kind of changed over time. That virus actually has kind of mutated a little bit and affects people a little bit differently. So a variety of factors, of course, influence your risk. The most important factor, though, is the health and strength of your immune system and how you're taking care of yourself. So benefits of microbes. Food production. Fermentation is actually what makes beer and wine. Yeast is what goes into our dough for making things like bread. And so that can be a very helpful process. Decomposition, that is that speed and breakdown of dead things that we see on the side of the road, roadkill, or things in soil. And then in medicine, we have penicillin, which has greatly changed our ability to overcome disease since the invention of that. So some of these benefits really are amazing and have been helpful. A bacteria is a single cell microorganism that can live almost anywhere. Most of them, the good news, is harmless and even important, but 1% of them can be harmful. So some of them are listed here on the slide, and maybe you've personally known someone who has one of them or have dealt with something along these lines yourself. But we want to do everything we can to try not to let a body have this come into contact. Antibiotics and antibiotic resistance are a thing to be concerned with because bacteria can adapt and become resistant to antibiotics. So this has created what we call superbugs, such as MRSA, having that ability of a body not to be able to fight off infection as easy because it's just used to using those antibiotics and it's already been around. So it's important to use them as needed to stop bacteria from reproducing. But again, sometimes our bodies are not able to do that if we get immune or become immune to that. So overprescribing of antibiotics is something that we have to be aware of and make sure we're only taking them when we absolutely need to. Best things we can do are stay up to date on vaccinations, wash our hands, and avoid infections in the first place. So viruses are single cells that contain genetic material, such as DNA or RNA, and they are encased in a tough outer shell. They can invade a healthy cell. I think of HIV as an example. And basically, they replicate themselves by combining their own genetic material. So common cold is an example of a virus that has no cure or vaccine. Influenza, people use antiviral drugs to treat them and possibly take annual flu shots. Hepatitis causes inflammation of our liver, and different strains can be transmitted in different ways. So viruses are typically lifelong in our system. A parasite is an organism that requires a host to provide a food source. So lice, fleas, worms can all be examples of parasites. And so these are something that we want to also be concerned with, make sure that we're trying not to be coming into contact with them. And those are some of the examples that you see listed here. Fungi. A fungus is a simple primitive organism like mold, mildew, and a mushroom. There are many types of them, and about half of them are harmful to us. Commonly, they begin on skin and in the respiratory tract. So there's a wide range of the infections like allergic reactions, lung infections, athlete's foot. Kind of an interesting way to deal with athlete's foot is just to put coconut oil on the area. And some athletes actually can just do that on a daily basis just for preventative because it helps to prevent that growth. Thrush is like a yeast infection in the mouth. Then there's also, of course, vaginal yeast infections, and then jock itch can also take place. So again, even in that case, using coconut oil can be very beneficial to that area. So antigens are markers carried by invading organisms. The human immune system protects the body from infectious microorganisms and other invaders. Antibodies created during the immune response are always available to respond if that organism strikes again. So usually our body does a wonderful job of making these and preventing further issues if that comes into place in the body again. So that gives us our immune response, and antibodies create that work against specific organisms. So it's a very beautiful thing that our body can do if it's working properly, and that's the hope. The immune system has many areas that help combat these diseases. Lymphoid organs, such as the spleen, thymus, bone marrow, they produce and store leukocytes, which are the white blood cells. I think of them as the powerhouse, the soldiers of our immune system. Types of leukocytes is called phagocytes. They eat pathogens, so I think of them like a Pac-Man, like the old video game, just kind of eating them up and helping the body to be avoided of them. Lymphocytes also recognize and kill pathogens that have infected the body before. So in general, the body does a great job of fighting off these issues because of the immune response. So the immune response happens when an organism enters the body and is recognized by antigens. The phagocytes start to eat it, consuming the invader, and present its material to other immune cells. The helper T cells trigger the action of B lymphocytes, which then begin producing antibodies. The killer T cells destroy the cells infected by the pathogen, and more phagocytes attack. So again, that's consistently going on. And then memory T cells help the body respond more rapidly to future infections. So then if it's present in the body again, the body recognizes that and will work on it. An autoimmune disease is when the immune system targets a healthy cell in the body. So things that occur in the system that are autoimmune have the body attacking itself. And we have a rise of those in our current day and age. The types of immunity, we have innate. This is what you're born with. So when you're born at birth, your body harbors antibodies and other natural defenses. And so that kind of helps the baby from getting sick. Adaptive immunity is when we create an immune response. So your body does get sick, but then it fights off a pathogen for the first time and it adapts. Passive is what we get from external sources such as vaccinations, and they help the body to fight off certain infections. So what we want to do is keep our immune system strong. Exercise reduces your chances of infection by boosting your overall health, making your body more resilient in general. And certain nutrients that we eat also boost the immune system and keep you healthier in general. Stress has been shown to weaken the immune system. So knowing that, we do the things that we can to kind of manage that stress, just like we talked about in our module 4. We want to do things to kind of make the stress work for us with that growth mindset. Sleep deprivation can also make the body more susceptible to infections such as colds and flu. And if you frequently do suffer infections or get sick a lot, definitely let your health provider know. So these things that are listed are all going to be helpful to helping you fight these diseases. So why are vaccines important? They prepare the body to fight in this passive way diseases by working with the body's natural defense system. So many vaccines are needed even for college students. We have vaccines to prevent bacterial meningitis. Tdap prevents tetanus and diphtheria and pertussis, which is whooping cough. HPV vaccine will prevent infection to the human papillomavirus and cancers that it can cause. And then things like the seasonal flu vaccine taken annually also can prevent infection by the most prevalent flu viruses during the upcoming flu season. So it's important that we understand it's a passive type of fighting, but it's helping our body system to fight off those diseases. So being informed, knowing that vaccination benefits outweigh the risks that can occur, and always talking to your healthcare provider first. So what makes your immune system strong, and what can hinder functionality of your immune system? So we've already kind of looked at some of those things, and really it's a personal journey for each one of us to try to adopt those healthy activities and habits in our life, like washing our hands. And that's going to help keep us stronger over time. Sexually transmitted diseases I had already talked about in our STI lessons. But keep in mind that these also can be spread in viral or bacterial from one person to the other, even parasites, during sexual activity. The two most common are chlamydia and human papillomavirus. Chlamydia, of course, is a bacteria. Human papillomavirus is a virus. In the United States, there are 20 million new sexually transmitted infections each year. That's, of course, known cases that have been actually turned into the CDC to know about. Nearly half are for people your age, between 15 and 24. So 1 in 4 sexually active girls do have STIs, and I know that we mentioned that in our earlier slideshow. So it's important to note that for many STIs, infected people may have minor or no signs or symptoms. In fact, 80% of females do not have signs at all because their symptoms might not be very clear. So it's important that if someone is being sexually active to get tested on a regular basis, especially if they have more than one sexual partner and they're not using precautions like condom use and being aware of their sexual partner's histories. So it's important for all sexually active individuals to talk to their healthcare providers regarding this and also getting tested when needed. We already talked about this, like I said before, but the bacterial STIs, the protozoan, and the viral. So the bacterial ones, like chlamydia, gonorrhea, these can actually lead to infertility. So it's super important that someone gets treated once they have one. And also infants and newborns can contract these from their mothers before, during, or after birth. So abstaining from sexual activity or abstinence is really the only guarantee against STIs. The next best thing is to be sexually active with just one partner who is only sexually active with you and they don't have an STI. Also, consistent and correct use of condoms reduces risk. So again, there's the two other types of STIs, and keep in mind the protozoan ones can be treated as well as the bacterial, but viral ones can have treatments, but they won't be cured. They'll be a lifelong for the rest of their life. So what do you do and what can you do to protect yourself from getting an STI or other infection? Just making sure that you're doing all of those safe behaviors like abstinence, using condoms. But then, of course, for all the infectious diseases out there, keeping our hands washed, making sure that we're not putting ourselves in danger by going around people that we know are sick, and just trying to stay clear of that when we can. So going forward, explaining how pathogens infect people and describe behaviors you can practice that will prevent you and others from becoming infected. Hopefully you feel like you have a better understanding of how to do that. Know that infectious diseases that you are most at risk for, given your circumstances. Be familiar with vaccine guidelines and recommendations for you. Know what you can do to strengthen and maintain a healthy immune system, and understand sexually transmitted infections, and do everything that you can to avoid them. Make good choices, and we'll see you in the next one.